Hello and welcome to Logan, and MK's quick guide to Gait. In today's episode, we're going to be going in an in-depth analysis of each of the phases of Gait and looking at each of the joints involved. So, starting with initial contact, looking at the ankle, you see that the ankle is in a neutral position, and this is optimize the heel rocker that's going to follow. Moving to the knee, we see that the knee's main function in this phase is stability. So the knee is extended somewhere between -2 and 5 degrees of flexion, and this is to provide the most stable position possible for the preparation of weight transfer that will happen. The hip, we see 30 degrees of hip flexion that presents optimal stability as well, and absorbing a vertical loading force and also frictional horizontal shear force from floor contact. Moving to the next phase, loading response. At the ankle, you see that the heel rocker that was presented in the initial contact allows for progression of the limb without compromising the stability of the joint. The dorsiflexors draw the tibia towards the front and then progresses the limb while also limiting the heel rocker. At the knee, we see about 15 degrees of knee flexion. And this is really for the loading response as the weight's transferred to that limb. We have optimal shock absorption as the flexors and extensors of the knee work together to contract and take some of that, especially in the flexors of the knee. At the hip, in the loading response, we see single joint hip extensors play the largest role in hip stability. The semimembranosus assists in internal rotation as well, and this is for contralateral pelvic advancement. The trunk and lateral hip stabilizers are also firing, and that's for the effectuation of weight transfer during this phase. Moving to the next phase, we have mid stance. And this, at the ankle rocker is controlled by the eccentrically contracting soleus. And so all of this is to continue progression of the limb while also maintaining that stability at that joint. The knee in mid stance is extending on a stable unilateral weight-bearing knee, and so the soleus restrains the tibia, allowing the femur to progress. The body weight actually shifts 2 centimeters laterally during this phase and lies on the medial aspect of the knee, which it necessitates that the extrinsic lateral supporting muscles of the knee be active in this to maintain the integrity of that joint. Looking at the hip, we see that the hip moves from 30 degrees of flexion to a more neutral posture in this phase. In terminal stance, the ankle motion is limited, which leads to heel rise. And as a result of this, body weight moves to the metatarsal heads, and we see a transition from that ankle rocker to that toe rocker. This heel rise also has an effect on knee and terminal stance. The knee finishes extending to maximize stride length, and once body weight has moved far enough anterior to the forefoot rocker, the foot actually rotates and tibial stability is lost, which results in knee flexion. At the hip moves into extension such that the hip flexors then activate to restrain that extension and make sure that there is not hyperextension at the hip. Moving into pre-swing, rapid plantar flexion of the ankle advances the unloaded limb. And so all this at this phase, we're now looking less at stability and more into limb advancement. The heel rise results in knee flexion, and unloading the limb allows for 40 degrees of passive knee flexion. All those knee flexors were firing previously, but because of the restrictions of the soleus muscle, there was not as much knee flexion. So now that the limb's been unloaded, those knee flexors, while firing at the same rate, are able to do a lot more work in moving the limb. And all of this in pre-swing is to prepare for the necessities of swing and foot clearance. So at the hip, we see that the hip flexors are now activating, that we're in an extended hip, and we're going to want to get some hip flexion so that to advance the limb. Moving to the next phase of initial swing, at the ankle, we see that the main role and function of the ankle in this phase is floor clearance for limb advancement. So the dorsiflexors of the foot reverse the pre-swing plantar flexion that was used to get that heel rise and the knee flexion, and those dorsiflexors are going to try to pick up the toes a little bit. Looking at the knee, we see that the knee flexion is critical despite the foot clearance being the main goal of this phase, the knee flexors are used as the primary mode of picking up the equinus foot, as opposed to simply the dorsiflexors. The dorsiflexors of the ankle will primarily bring the foot up to a neutral position. At the hip, the unloaded limb is able to rapidly flex, while sartorius and gracilis are the main hip flexors that are firing. They're also synergistic, flexing the knee. In mid-swing now, at the ankle, the main task here is to maintain that neutral ankle. And we'll see this throughout. That's where we want to be when we get back to the top of the gait cycle. The knee, we have, once the foot is past the hip, knee flexion is no longer needed. So extension begins in preparation for the final phase, which we'll get to in a second. No muscles are really needed for this extension because it's able to passively just use the momentum that's already acquired to get that extension. Same thing at the hip. The momentum carries the hip through that flexion. Now moving on to our last phase, the ankle. For terminal swing, we see that it's still preparing the neutral ankle, which, as we said earlier, is the optimal position for the heel rocker and for stability in that initial contact and weight bearing. And so the quads and the knee complete the extension, since that passive extension is not enough to get the knee to where it needs to be fully extended. This complete extension also serves to lengthen the step and get an optimal step length, and prepares the limb for contact and for weight bearing. At the hip, the hamstring muscles decelerate the hip now so as to not over flex the hip. Quick shout out to our sponsors, Jacqueline Perry, the writer of the Gait Analysis Normal Pathological Function, our textbook, and also to Alice.